Hey guys, John here with ChiroFit Health and Wellness, and we're here to talk about something I talk about all the time. And so when we're looking at the human body, especially the pelvis and the lower back, we always get interruptions in this area. And then people come in and they say, oh, I have sciatica, I have tingling down my leg, my hip hurts, my back's tight. And so a lot of it comes from right here, because if we look at everything, the whole entire spine sits on the sacrum, the hips connect into the sacrum. So for all intents and purposes, this is like the master switch. So if that thing is off and twisted forward, that anterior pelvic tilt that everyone talks about, we're gonna have major issues. And so if we look at some of the corners down here, what are they attached to? They're attached to some of these muscles, and people have heard of piriformis syndrome and all kinds of different things. Well, if some of these muscles start hijacking the function of the glute medius, glute maximus, and the hamstring, we're gonna have major issues, because that sacrum is gonna twist and go forward to the left or the right or anything, and it's gonna throw the entire spine off, throw the hips off as well. And so when we come back to our skeleton here, we also look, well, there's the muscles we're talking about right here. What is that big honker coming through there? That's your sciatic nerve. So when people come in and they have, oh, like a tingling coming down here, sometimes it's piriformis syndrome, but also you can have entrapment or issues up in here where the discs are. Because we turn around to the front, we've got this massive sacral plexus. What's the sacral plexus running through? Your sacrum. So if that sacrum's off, it is major issue, and that's what a lot of people miss. They go looking at the lumbar spine, oh, everything's in here. Well, that's all kind of downstream stuff because that sacrum is off. So we need to address that sacrum by doing an adjustment on it and getting it back to that neutral position. Then what happens? Well, we got to address the muscles, because if those muscles are still pulling and they're doing what they're not supposed to be doing, we're going to have major issues as well, and it's going to pull right back out. So we need to stretch certain muscles and we need to strengthen certain muscles. And so a lot of people are big into, oh, I got to strengthen my glute maximus. Yes, you do, but your glute medius is kind of the beginning of that, to the maximus, to the hamstring. So we need to strengthen this whole thing. Well, we need to start here a lot of times. And so what we're going to show you today is just a stretch you can do here, and then some strengthening you can do for the glute medius to kind of alleviate that. So the first simple stretch, and I go over this a lot with our patients, we just get close to the wall like this, get our butt really close up against the wall, then we're going to shift over like this and get your feet way up in the air like that. I want your butt way off the ground and even your middle back way off the ground. Then you're going to cross your leg like this, because this way, when you're letting your pelvis sink, it's stretching. So if my left leg is on top of my knee, I'm stretching the left piriformis, glute minimus, some of that stuff. And so I'm just going to kind of lean and let the weight of the pelvis kind of stretch that out like this. And usually I'll say about 1:30. So set your phone for 1:30 seconds, or your watch for 1:30 seconds. Let your pelvis sink for the first 30 seconds. You'll start to feel a pretty good stretch over here. Then you're going to actively start stretching it. So you're going to place your hand on your ankle, other hand underneath on your knee. You're going to pull out like this and push down. And when you get this, you're going to feel a massive stretch all of a sudden. You're going to hold this for another minute. So we're just shooting for about 1:30 seconds, and then we're always going to stretch the other side. So we just shift back the weight like this. And again, you can sit here and control your breathing this entire time. You're not grabbing and flexing and pulling stuff. You're just letting gravity do a lot of work, and then you're just simply pressing and pulling out. So you can sit there and really control your breathing and sink into that stretch really well. That will really help stretch some of those muscles that are kind of hijacking the function of the glute medius and the glute maximus. So from there, you're going to get up against the wall, and so we come over here and we want to strengthen that glute medius up here, because a lot of times people are weak in their glute maximus and their glute medius. We need to strengthen both, and the glute maximus can be strengthened a little easier than the medius. The medius is very particular. So we get up against the wall like this, and we want to place our ankle touching, or the back of our heel touching the wall like this. We're going to turn our foot in and keep it touching the wall the entire time. And what I like to do, I'll go through and do 10-second holds like this. And this looks like it's really easy, but you go and try this and your glute medius will start on fire. It is one of the best exercises to get that glute medius basically like out of its amnesia state. So you come down like that and slowly come up, and just hold, and you should feel rock hard right here, and that's the glute medius. If you're strengthening that, and we can do other simple things like this, like the bird dog, and strengthen the glute maximus, and again, both sides, we're getting this chain to fire appropriately again, which is gonna pull you back out of that anterior pelvic tilt and help fix that sacrum. Your sciatic nerve issues will go away unless you have degenerative disc and you have disc issues. Your sciatic nerve issues a lot of times go away. Piriformis syndrome goes away. Then the pelvis just starts operating correctly again, which has a huge impact, obviously, like we're talking about, on the spine, hips, hip sockets, knees, ankles, and everything, because we're not transferring goofy weight anymore. Everything's balanced again.